Hello, I am Robert Nipper. I'm a consultant in nephrology and acute medicine. I am the revalidation and appraisal lead for Salford Care Organisation at the NCA. I am covering the outputs of appraisal and the importance of this within the appraisal process for the appraisee and the appraiser. I'm going to cover the outputs of appraisal. Please see the previous videos on the other important components of the appraisal and introduction to the appraisal process and prep. The output form basically consists of three of the following. 1. The Personal Development Plan, the PDP. 2. The summary of the appraisal portfolio and discussion. And 3. The appraiser's statement and any explanatory commentary to the responsible officer by the appraiser or the doctor. I encourage the appraisees to plan a PDP before the appraisal discussion. Your appraiser may suggest some PDPs following the discussion, and the appraiser should help the doctor to define and clarify their most important goals during the appraisal process. Now, the PDP is an itemized list of individual objectives or goals that support professional and personal development for the period until the next appraisal. Now, these need to be SMART, specific, measurable, achievable, realistic, and time-bound. Agreeing and capturing these in written form is an important output from the appraisal process. It is important for the appraisee to produce a very good input form and help the appraiser to get a good output form. There should be reflections and an agreed plan of development. In the appraisal meeting, the discussion should be focused to explore evidence for documentation in the output form. All domain statements need to be backed up with evidence, with the concluding part being the appraiser's statement. Now, the appraiser needs to summarize the output using the following headings. 1. A summary of core information. 2. Keeping up to date, so that's CPDs and QI projects. 3. A review of clinical practice. 4. A review of management practice. 5. A review of research practice. 6. Significant events being reviewed. 7. Feedback from colleagues and patients. The whole appraisal process is underpinned by the following 4 domains, which were recommended by the GMC. 1 is knowledge, skills, and performance. 2 is safety and quality. 3 is communication, partnership, and teamwork. And 4 is maintaining trust. This is an important framework for completing the output form for appraisers and appraisees. Now, please pause and read through the suggestions on this slide for your consideration. Part of the value of your appraisal is the protected time and space to debrief with a trained colleague. Part of the value is the opportunity to plan for the next period and the challenges you face in both your personal and professional development. Use the appraisal to discuss your goals and what is important to you with your appraisees and to help you to access the support that you need. All doctors deserve the benefits that the best appraisal already provides. Thank you. Hello, I'm Rob Nipper. I'm a consultant in nephrology and acute medicine. I am the revalidation and appraisal lead for the Salford Care Organisation at the NCA. In this video, I'll be covering the subject of declarations of interest. In regards to your declaration of interest, it needs to describe your whole scope of practice. You need to declare all the places you have worked and the roles you have carried out as a doctor since your last appraisal. Your supporting information should cover all aspects of your work over the revalidation cycle. Your supporting evidence must cover any work you do in your clinical roles, your non-clinical roles such as education, research, academia, management or leadership roles, as well as both in the NHS and independent sector, voluntary work and private work as well. In regards to your professional obligations, it's very important to give an honest and comprehensive picture of your whole practice for revalidation. And this should be very important and an important focus in your appraisal practice that covers all of the work that you do. You must make sure that your responsible officer and appraisee is aware of all the places you have worked as a licensed doctor since your last appraisal. And you must make sure that your supporting evidence and any other evidence from your whole practice appraisal is both honest, accurate, and comprehensive. The role of your appraiser in all of this is not just to make sure that the declaration of interest box is ticked. It's important to make sure that the whole scope of work is explored and is very clear to the appraisee what this actually means. It is a very important part of the appraisal meeting. As previously highlighted in the video on the input form via the PREP system, there is a section within the scope of work section which highlights the need to make a declaration around your full scope of work. In addition to this, the Declaration of Interest app needs to be completed for all doctors. The Declaration of Interest app is located within the corporate section of the NCA intranet under Declarations of Interest. On this slide, I've highlighted the details that need to be completed using my own details for now. By inputting your name, the system will be able to find your division and organisation and ask you to confirm if these details are correct. The following slide shows you the steps required to take if you have a declaration to make. Now please pause and spend a moment to look at the relevant headings for the different types of declarations. If you have no declarations, this section is simple, and you will just need to choose the option that you have had no declarations to make. On completing the declaration, there is an Accept Declaration page to complete. Once the acceptance of the declaration is done, you are informed that it has been successfully completed and a submission number is generated.